Yes. You can start now. Yeah, Josephine.
Yes, please.
Yeah, you can start now.
All right. Good morning, Miss. Should I use a name for the patient?
Yeah, you can ask me or you can use because you know that you can, if you, before we start, you can ask any questions. No problem.
All right. Good morning, Mr. Simon. How are you today?
Yeah, I am very fine. But yeah, okay, that's the reason. There's a reason why I came to you. The doctor asked me to meet you, so I'm a little bit upset.
Oh, Mr. Simon, I understand how you feel. I know even so many patients feel anxious whenever they are asked to inject themselves of insulin, and I totally understand it's normal. However, first of all, I would like to know if you know the reason why you are meant to take in this insulin. Do you know that?
That's the reason why I'm asking. I'm doing well with my medication. I'm going on with my diabetes diet and exercise program for the last 3.5 years. Everything is set fine. I'm good, managing well. So all of a sudden, doctor told me to go for some report, blood report, and some reports he asked me, and then I gave them. And afterwards, he told me to meet you and discuss. I don't know why he's telling me to take injections. I don't understand.
All right, Mr. Simon. Well, first of all, one of the reasons that you might be asked to take the insulin injections is one, maybe your body is not processing insulin as it should, or secondly, if in a case your body is not producing insulin on its own. However, whenever you want to take insulin injection, you should know that this insulin will help your body to break down the to break down carbohydrates into energy, and also help it to process the insulin the and also help it to process the
Manage the blood sugar levels.
to manage the blood sugar levels very well. And again, whenever you want to take in the insulin, just ensure that you clean your hands very, very well. You can also use alcohol swab to clean the area that you want to inject these insulins into. There are three major parts that you can be able to inject yourself in. We have the abdomen, which is your tummy or stomach, then the upper hand or on your thigh. I know that even the needle, I understand that you might be scared of injecting yourself with the needle, but not to worry. The needle is usually short. So many patients um always say that it feels like a pinch on their skin whenever they want to give themselves this shot of insulin. The pain is not usually intense, but just know that you will feel it like a pinch, and also ensure that you leave it for about 15 to 10 seconds in, so that the dosage can be able to go in as prescribed. If you want to give in this insulin, take a look at the proper dosage that have been administered for you to take in, so that you don't end up giving yourself an overdose. Also, after taking this insulin, ensure you have some rest. Do not overstress yourself. please, as this will help your body to process the as this will help the insulin to process and manage your blood sugar level properly. Also, note that whenever you are done giving this insulin or taking the shots, you have to dispose the needles safely by closing the cap, and also ensuring that it is being discarded in a safe place without the reach of children or any other person that is around the environment.
Yeah, that's absolutely fine, nurse. But my main point is, I just don't really like the thought of injecting myself. I don't think I'll be able to do it. Oh, I think I'm scared.
All right, Mr. Simon, I also understand that. Would you like me to help explain, or would you like to watch me, or would
Ye-
you like to do it while I observe you and be sure that you can do it properly on your own without being observed?
Yeah, that's
Why?
quite fine. But I want
All
to
right.
know if there is any other way to manage my diabetes other than these injections.
Yes, you can also do that with diet. You can
Uh,
also do that with managing your diet and your lifestyle too.
it,
Ensuring that you don't take in too much of carbohydrates. You take them moderately, and also take in more of raw veggies or vegetables. And
it,
also know that this insulin can be taken in, that an overdose can happen. And when this occurs, it can lead to either high insulin level, which is
Right, I understand what you're telling. The information is very clear. And yeah, now I have five places to take these injections, yeah, abdomen, area around the abdomen, belly button, and then the two shoulders and the two inner areas of the thighs. So that's fine. But should I use the same needle every day or should I change?
no, you have to change the needle every day. Once you are done using one of the needles, you discard it safely. And then whenever you want to give a shot of this insulin, you will need a new needle for that. Okay, is that all right?
Yeah, that's fine. And what should I do with these used needles and syringes? Where should I discard them? Should I discard them as a normal waste of waste in the houses, or should I? Is there any special way to discard these materials?
Yes, there is. You can discard needles in inside the safety bins.
Okay, fine. That's very good. Is there anything that you want me to suggest? You want to suggest me, for example, will there be any bruises or side effects or any itching or, anything like that?
Yes, there's usually, you can see some side effects, such as bruising if the area of injection is irritating. And when this happens, you can use ice pack just to calm the area down. Also, you can look out for um,
Any signs of bruising?
lumps rather.
Okay.
Yes, you, you could see signs of lumps around the area of injection. And when that occurs, please do not repeat the injection in that same area until it goes down.
Yeah, thank you very much, nurse. Your suggestions have been very excellent, and I am better about the injections now, and I'm ready for you to watch me give myself an injection and guide me if they am doing anything wrong.
All right, Mr. Simon, I'm glad you were able to get every explanation that I've given so far, and I'm also very happy to guide you step by step to do that right now.
Yeah, that's really wonderful. Okay, now let me give you some feedback for your session. So first, tell me how did you feel before my feedback? To tell me this is your first speaking session with me. How did you feel when we are recording and live doing this on the YouTube? How do you feel? Is this um, your experience? Tell me.
I I know I wasn't getting it so right, but I felt I felt like, is this something that I can do?
Mm. Yes, that's
I
the
know I
positive
can do
thing. Yeah,
it,
come on,
but
go ahead. Go ahead, explain.
yes, it's like I know I'm still struggling on how to combine the answers together and then make it look straightforward and understandable for my patients.
Yeah, that's absolutely fine. Now, no need to worry. You are with me. When you can do with me, you can do with the examiner also in the real exam. So no need to panic. So this is
All right,
practice,
sir.
practice, 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 and practice makes a man perfect. So you are doing
All right,
well
sir.
so far. You have no problem with your language. You have no problem with your plans. You have no problem with many different things, but you have some areas you have to focus. First thing is there is an order. There is an order.
Okay.
You are messing up the order. For example, you are mixing up everything. So there are some points. First, what you have to do. Second, what you have to do. Third, what you have to do. So first one is you have to ask why I came there, right?
Okay.
Second one, you
Yes.
have to comfort me regarding my anxiety. Find out why I am feeling anxious, why I'm
Okay.
upset. Then afterwards, you have to reassure me, nothing to worry like that. Then next, emphasize injections. These are the best options. You cannot manage with medication, but now you have to take insulin injection. This is the last option. Okay.
Okay.
So like that, you have to talk about injections. Then lastly, you have to tell how to dispose the needles and how to manage things. Is that clear?
Yes.
So you are doing fine. Otherwise, there are some pauses and breaks. For example, in between, you're passing, suddenly you're getting stuck, right? And you
Yes.
don't know what to speak. So you have to practice more, okay? You have to
All right.
practice more. The same speaking card again after maybe 1 week or 10 days, we'll do the same. By that time, you will be improving, okay?
All right, sir.
Once we'll go around of 15 to 20 days, then we'll go through all these again. So that time you'll be
All right.
confident because this is a beginning stage. Ne? You'll be little panicking. No need to panic. See, you are a nurse. I'm a patient. Don't think I'm a teacher. You are a
All right, sir.
student. If you think that you are a student and I'm a teacher, you'll be afraid. Oh, I don't know English like that. No, you are a nurse and I'm a patient. You are the master here. You know everything about the problem. I don't know anything.
Oh,
So you are strong. Na? Like that, you have to build yourself up. You understand?
all right.
If you think that you are a student, then you'll think, I don't know. He is Mr. Simon, he is a teacher, so I'm afraid. Like that, it will be. Huh?
Yes.
But if you think I'm a nurse, this is Mr. Peter, he's a patient, he doesn't know anything, I'm the boss. Now you'll be very strong. You understand?
Yes, sir.
Now you understand how you have to make yourself strong?
Yes, I do.
That's it. That's it. Okay?
Yes.
And
Thank
next thing
you.
is there are some like that you are saying.
Yes. Yes.
So those sounds should not come. So avoid as
All
much as
right.
possible.
All right.
And then you have some hesitation. Sometimes you don't get words, you don't get sentences, you are struggling, you are thinking about one particular word or two words, but those words you are not able to recollect, so you are getting stuck and you full stop. Then I'm helping you. Two times I helped you like that, correct?
Yes.
So if you don't get anything, leave that. No, try to think something else. There are a lot of things to speak, right?
Yes.
Why do you want to go to that one only particularly? So you need not. So now, for example,
All
you
right.
have to talk like this. See, now you will ask me now one question, and then I'll tell you how I will speak as a nurse. You are a patient now.
All All right, nurse, I want to know, how do I manage discarding the needles whenever I'm done using them?
That's a wonderful question, Josephine. I appreciate you for that. Actually, these are medical equipment. If you are careful, then fine. If you are not careful, you may get a needle prick injection, needle prick, or hurts or cuts or bruises. If you are careless, there may be some children or there may be some elders, unknowingly they may get hurt. So you have to dispose these very carefully. You have to use a different method, altogether, because these are medical waste, because there may be side effects. If somebody gets, there may be infections. So don't do those things. So what you do, this is a container, this blue container. This is for storing, your waste, disposable container. This is blue in color. See, now what you have to do is, when you use, immediately after that, you open the lid, dispose all these used, broken vials, injections, needles, syringes, and everything whichever you use, dispose this off into this container, and then immediately tighten the lid and keep it at a safe place, away from the reach of children and others. Now, this can become full, when it is 3/4 full, that time you can replace this with another container. So you can get that one to the pharmacy or to the hospital, give it to us, and you can take an empty one instead. Otherwise, you can buy it from the market, or do something else. You can procure a new one. But this one should be brought to the hospital and be given to this person who secured them. So something you have to speak like this. So you have to plan very carefully. So every time you use a syringe, a needle, or a vial, you break them, and then what you have to do is dispose them safely into the container to avoid unnecessary harm or injuries to children or other people in your house. Prevention is better than cure. So something you have to speak. English is very, very important. Speaking English is very, very important. That's what I'm telling you. So speak freely as if you are a nurse. You are a nurse. So speak as if you are a professional. That's all. No need to panic. Now you
Oh,
have 5 places where you have to take this injection. The first one is the area around the belly button, or you call umbilical cord. The next two are the shoulders, right shoulder and the left shoulder. And the other two are the inner areas of the thighs, left thigh and right thigh. Now, let it keep a clockwise direction. Clockwise direction. Now, first, you take your injection on the left shoulder. The next day, you take on the left thigh. Then you take the injection and the area around the umbilical cord, then the right thigh, then the right shoulder. So you can make a pain diary, injection diary, and you have to make a date, note, and everything, so that you will not take the injection on the very same place that you have taken yesterday. So it will be a cycle, cycle. So that is safe side. Why this like this? Because repeatedly taking the injection in the same place might result in negative impact. So there may be side effects like bruising, itching, scratching, or sometimes lump formation or even bleeding. So to avoid all these things, it is better to rotate the site on a daily basis. See how I am speaking? Are you able to understand?
yes.
I'm not a nurse, but I have a plan. Like that, you should also have a plan. It should be like, wow, how nicely she's talking. Like that, that feeling should be there. Okay?
Yeah.
One by one. See, order. First the left shoulder, then the left thigh, then the area around the umbilical cord. And on the fourth day, you have the right thigh. And on the fifth day, you have the right shoulder. So now a cycle is complete. Then again repeat. Now all these things you have to make a note in your diary. And once you take the injection, tick it so that you will not get confused. To write the date and the time. So make it standard. make it a standard. Is that clear?
Yes,
One
sir.
second. So that's how it is going to happen. That's how it is going to happen. Are you comfortable now? Are you happy?
Yes.
So if we don't record, you will miss all this feedback. You will forget everything, right?
Yeah.
So now I'll give you the link. You go and watch that video. Then you will know. You make some points, note some points, how you are doing mistakes. After 20 days, you see how you are doing and compare with this time. So every day you can compare with the past videos and how you are improving, right?
Yes, sir.
See what all I told you. There should be an organization. There should be a step-by-step procedure. You should not panic. You should avoid hesitation. You should get stuck in between. You should not say unnecessary sounds like that. Now you understand what I'm saying. All these points, make note. Slowly, 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 you will recover. Okay.
Okay.
So that's the end of this session. Now what you can do is you can prepare another card, second card, and you can message me. Then I'll take another speaking session. Okay.
All right. Thank you, sir.
Right.